Diabetes mellitus. DM. Welcome to this enlightening session on diabetes mellitus DM, a condition that has become one of the most common health challenges of our generation. Yet, many people still don't fully understand what it is, how it affects the body, or how powerfully and lifestyle choices can work together to manage and even prevent it. In this presentation, we're going beyond the medical terms. We will break down what diabetes is, explore its causes, symptoms, complications, and most importantly, learn practical steps and biblical principles for prevention and management. Remember, the Bible reminds us in 3 John 1:2, "Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers." God's desire is not just for our spiritual well-being, but also for our physical health. Understanding diabetes is one way we take charge of the body He has entrusted to us. So stay with us till the end, because this knowledge could save your life or the life of someone you love. Let's dive in and discover how to live strong, healthy, and purpose-driven lives, free from the grip of diabetes. Introduction. 1. Diabetes mellitus DM is a chronic health condition where the body cannot properly regulate blood sugar glucose. This happens either because the body does not produce enough insulin or cannot use it effectively, leading to high blood sugar levels over time. It is one of the fastest-growing health problems worldwide. Millions of people across the globe are living with diabetes, and the number continues to rise due to modern lifestyle changes. 3. It leads to serious complications if uncontrolled: heart disease, kidney failure, blindness, amputations, and even death. Persistently high blood sugar damages blood vessels and vital organs, causing life-threatening health issues if not managed properly. 4. In Ghana and Africa, more people are being diagnosed with diabetes due to lifestyle changes, urbanization, and unhealthy diets. As more people adopt sedentary lifestyles and consume processed, high-sugar foods, diabetes is becoming increasingly common in our communities. Hosea 4:6, "My people are destroyed for lack of knowledge." Many suffer unnecessarily because they do not understand the disease, its risks, or how to prevent it, which is why education is essential. We are here to gain knowledge and protect our health. By learning about diabetes, we empower ourselves to make better choices and reduce the risk of complications, living healthier and longer lives. What is diabetes mellitus? 1. Normally, the pancreas produces insulin, a hormone that helps the body use sugar for energy. Insulin acts like a key, allowing glucose from the food we eat to enter the body's cells, where it is converted into energy needed for daily activities. 2. In diabetes, this natural process is disrupted, leading to an imbalance in how the body manages blood sugar. 1. Either the body does not produce insulin. This happens mainly in type 1 diabetes, where the pancreas produces little or no insulin, requiring external insulin for survival. 2. Or the body cannot use insulin properly, insulin resistance. This is common in type 2 diabetes, where the body produces insulin but the cells do not respond to it effectively, causing glucose to remain in the bloodstream. 3. Result: too much sugar glucose in the blood. Over time, high blood sugar damages blood vessels and organs, leading to complications if not properly managed. Types of diabetes. 1. Type 1 German mark, usually starts in children or young people. Body produces no insulin. Lifelong insulin injections needed. This type is an autoimmune condition where the immune system attacks and destroys the insulin-producing cells in the pancreas. Without insulin, blood sugar cannot be controlled, so daily insulin injections are essential for survival. 2. Type 2 German marks, most common. Often in adults. Related to lifestyle, obesity, and genetics. In this form, the body still produces insulin but either not enough or the cells do not respond to it properly. It develops gradually and is often linked to poor diet, lack of exercise, excess weight, and family history. 3. Gestational diabetes occurs during pregnancy. May resolve after delivery but increases future risk. Hormonal changes in pregnancy can cause temporary insulin resistance. Blood sugar usually returns to normal after childbirth, but women who have had gestational diabetes are at higher risk of developing type 2 diabetes later in life. Risk factors. Some factors that increase the risk of diabetes cannot be changed, while others are linked to lifestyle choices and can be controlled. Understanding both types helps in prevention and early management of the disease. Uncontrollable factors. These are factors beyond our control, but knowing them helps us stay alert and take preventive actions. 1. Family history of diabetes. If close relatives have diabetes, your chances of developing it are higher due to genetic influence. 2. Age. Risk increases with age. As we get older, the body becomes less efficient at using insulin, increasing the risk of type 2 diabetes. 3. Ethnicity. Africans are more at risk. People of African descent and certain ethnic groups have a higher genetic tendency to develop diabetes. Controllable factors. These are lifestyle-related risk factors that can be reduced or eliminated with healthy choices. 1. Overweight or obesity. Excess body fat, especially around the abdomen, makes it harder for the body to use insulin effectively. 2. Lack of physical activity. A sedentary lifestyle reduces the body's sensitivity to insulin and contributes to weight gain. 3. Poor diet. High sugar, processed foods, fatty foods. Unhealthy eating habits raise blood sugar levels and increase the risk of obesity and diabetes. 4. High blood pressure and high cholesterol. These conditions are often linked to insulin resistance and increase the risk of developing type 2 diabetes. 5. Smoking and alcohol use. Smoking damages blood vessels, and excessive alcohol can affect blood sugar control and weight gain. 1 Corinthians 6:19, Your body is the temple of the Holy Spirit. This reminds us to take care of our bodies by making wise lifestyle choices that protect our health. We must guard our lifestyle choices. Practicing healthy habits reduces the risk of diabetes and lets us honor God with our bodies. Symptoms of diabetes. Sometimes diabetes develops silently. Many people may not realize they have diabetes because early stages often show no obvious signs until blood sugar is very high. 1. Excessive thirst. Polydipsia. High blood sugar causes the body to draw water from tissues, leading to constant thirst and a dry mouth. 3. Frequent urination. Polyuria. The kidneys work harder to remove excess glucose from the blood, resulting in frequent trips to the bathroom, especially at night. 3. Increased hunger. Polyphagia. Because the body's cells are not getting enough energy from glucose, hunger increases even after eating. 4. Unexplained weight loss. When the body can't use glucose properly, it starts breaking down fat and muscle for energy, causing weight loss without trying. 5. Tiredness, weakness. Lack of glucose entering the cells leads to low energy levels, causing persistent fatigue and weakness. 6. Blurred vision. High blood sugar can cause fluid changes in the eye's lens, affecting focus and causing vision problems. 7. Slow healing of wounds. High glucose levels damage blood vessels and impair circulation, slowing the body's natural healing process. 8. Frequent infections. Skin, gums, urinary tract. Elevated blood sugar weakens the immune system, making the body more prone to infections. Some people have no symptoms until complications appear. This is why regular blood sugar testing is crucial, especially for those with risk factors, to detect diabetes early and prevent damage. Complications of uncontrolled diabetes. 1. Long-term high blood sugar damages organs. Persistent elevated glucose levels over time harm blood vessels and nerves, leading to serious health problems. 2. Brain and heart. Stroke, heart attack, heart failure. High blood sugar increases the risk of blood clots and damages arteries, which can cause strokes, heart attacks, or weaken the heart. 3. Kidneys. Kidney failure leading to dialysis. Diabetes can damage the tiny blood vessels in the kidneys, reducing their ability to filter and sometimes leading to kidney failure requiring dialysis. 4. Eyes. Diabetic retinopathy leading to blindness. Damage to the blood vessels in the eyes can impair vision and, if untreated, lead to permanent blindness. 5. Feet. Nerve damage plus blood flow leading to ulcers, amputations. Reduced sensation and poor circulation make injuries and infections more likely, sometimes resulting in ulcers or the need for amputation. 6. Nerves. Neuropathy. Tingling, pain, numbness. High blood sugar damages nerves, causing discomfort, loss of sensation, or chronic pain, especially in the hands and feet. 7. Infections. Higher risk due to weak immune system. Diabetes impairs immune function, making it harder for the body to fight off infections in the skin, gums, urinary tract, and other areas. 8. John 10:10. The thief comes only to steal, kill and destroy. I have come that they may have life. Uncontrolled diabetes can steal health and life, but God desires for us to live long, healthy, and abundant lives when we take care of our bodies. Diagnosis. Blood tests are used to confirm diabetes. These tests measure the level of glucose in the blood to determine if it is consistently higher than normal, which indicates diabetes. 1. Fasting blood sugar is greater than or equal to 7.0 mmol/L 120 mg per deciliter. This test measures blood sugar after at least 8 hours of no food or drink. Levels that are above this threshold suggest diabetes. 2. Random blood sugar is greater than or equal to 11.1 mmol/L 200 mg per deciliter. This test measures blood sugar at any time of the day, regardless of meals. High readings indicate possible diabetes, especially if symptoms are present. 3. HbA1c is greater than or equal to 6.5%, measures long-term sugar control. The HbA1c test shows the average blood sugar levels over the past 2 to 3 months, giving a long-term view of glucose control and helping confirm a diabetes diagnosis. Management of diabetes. Diabetes cannot usually be cured, but it can be controlled. With proper management, people with diabetes can live long, healthy lives and prevent complications. Lifestyle modification. Healthy habits are the foundation of diabetes management to help control blood sugar naturally. 1. Healthy diet. Low sugar, more fruits, vegetables, whole grains, lean protein. Eating nutrient-rich foods helps stabilize blood sugar and supports overall health. 2. Avoid processed foods, fried foods, and excess salt. These foods can raise blood sugar, increase weight, and contribute to heart disease, which is already a risk for people with diabetes. 3. Regular exercise, walking, jogging, dancing, cycling, at least 30 minutes, 5 days a week. Physical activity helps the body use insulin more effectively and lowers blood sugar levels. 4. Maintain healthy weight. Achieving and maintaining a healthy weight improves insulin sensitivity and reduces the risk of type 2 diabetes complications. 5. Quit smoking and reduce alcohol. Smoking and excessive alcohol worsen blood sugar control and increase the risk of heart disease, nerve damage, and kidney problems. Medications. Some people with diabetes require medication in addition to lifestyle changes to control blood sugar effectively. 1. Type 1. Lifelong insulin injections. People with type 1 diabetes cannot produce insulin, so regular insulin injections are essential for survival. 2. Type 2. Oral tablets, e.g., metformin, and sometimes insulin. Oral medications help the body use insulin better or reduce glucose production, and insulin may be added if needed. 3. Take medicines consistently as prescribed. Regular use ensures blood sugar remains stable and reduces the risk of complications. Regular monitoring. Monitoring helps track blood sugar levels and ensures timely adjustments in diet, exercise, or medication. 1. Check blood sugar regularly. Home or clinic testing provides immediate feedback on how well diabetes is being managed. 2. Routine hospital visits. Periodic checkups help detect early complications and adjust treatment as needed. 3. Foot checks. To avoid ulcers and infections. Diabetes damage nerves and blood flow in the feet, so regular inspection prevents serious infections or amputations. Prevention. 1. Even if you don't have diabetes, you can reduce your risk. Preventive measures help maintain healthy blood sugar levels and lower the likelihood of developing diabetes in the future. 2. Eat a balanced diet. Consuming a variety of nutrient-rich foods, including fruits, vegetables, whole grains, and lean proteins, supports stable blood sugar and overall health. 3. Exercise regularly. Physical activity helps the body use insulin efficiently, maintains a healthy weight, and strengthens the heart and muscles. 4. Keep weight under control. Maintaining a healthy weight reduces the risk of insulin resistance and type 2 diabetes. 5. Check blood sugar at least once a year. Annual testing helps detect early changes in blood sugar, allowing for timely interventions before diabetes develops. 6. Manage stress through prayer, relaxation, and rest. Chronic stress can raise blood sugar and affect overall health, so managing stress promotes both physical and emotional well-being. 7. Proverbs 23:20-21. Do not join those who drink too much wine or gorge themselves on meat, for drunkards and gluttons become poor. Overeating, excessive alcohol, and unhealthy habits harm the body, highlighting the importance of self-control and healthy living. The role of faith. 1. Healing and good health come from God, Exodus 15:26. God is the ultimate source of life and wellness, and we can seek His guidance and blessings for our physical and spiritual health. 2. Faith does not replace medical care but works together with it. Trusting God complements, rather than substitutes, the use of doctors, medicine, and healthy practices in managing diseases. 3. Prayer, healthy lifestyle, and medical treatment equals holistic care. Combining spiritual practices, proper diet, exercise, and medical interventions addresses both the body and soul for overall well-being. James 2:26, Faith without works is dead. True faith is active. It involves taking responsible actions, such as following medical advice and adopting healthy habits, alongside trusting God. Trust God, but also take responsibility. We honor God by caring for the bodies He has given us while exercising wisdom, discipline, and proactive health measures. Practical tips for the church. 1. Organize regular diabetes and BP screening in the church. Regular screenings help detect high blood sugar and blood pressure early, allowing members to take timely action to prevent complications. 2. Encourage healthy cooking at home and churches. Teaching families and church groups to prepare balanced meals with less sugar, salt, and unhealthy fats promotes better long-term health. 3. Promote physical activity, church walks, aerobics. Group exercise activities make staying active enjoyable and help control weight, blood sugar, and blood pressure. 4. Educate on foot care and wound care. Diabetes can cause poor circulation and nerve damage, so proper foot care prevents infections, ulcers, and potential amputations. 5. Support members with diabetes emotionally and spiritually. Providing encouragement, prayer, and practical support helps members adhere to treatment and maintain a positive outlook on life and health. Conclusion. 1. Diabetes is a major health challenge, but with knowledge, prevention, and proper management, life can be full and fruitful. Understanding diabetes, taking preventive measures, and following treatment plans allow individuals to live healthy, productive lives despite condition. 2. As Christians, we must care for our health to serve God longer and stronger. Maintaining good health enables us to fulfill our God-given purpose and serve others effectively, showing gratitude for the life and body He has given us. 3 John 1:2 Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. God desires both spiritual and physical well-being for us, and taking care of our bodies aligns with His will for a balanced, abundant life. Thank you for watching. If you like this content, don't forget to like to show your support, comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.